Hello, class. According to Winston, counselors should know about assessment because the American Counselor Association Code of Ethics devoted an entire section to evaluation, assessment, and interpretation. Correct also stipulated that 8 common core areas are required of all students in accredited counseling programs, one of which is assessment, and assessment is one of the major topics on the National Counselor Examination. So, assessment is vital. What are the benefits? Assessment can be used to identify clients' problem. It can be used to evaluate and diagnose their issues. It also helps this counselor in training to plan for treatment for her counselor. It provides information to the client about their issues and it provides hope of encouragement that they can be helped. What are some of the drawbacks? Some of the drawbacks would be an experienced counselor who is not skilled in the interpretation of the assessment calculated data. And because of that unskilled profession, they may misinterpret the data results, whereby labeling the client. And so the bottom line is the counselor should be skilled and should be experienced. Um, how might you begin the assessment process? Well, it depends on the assessment tool that this counselor will be using because every client is different, their culture, their nationality, so things like that will have to be taken into consideration. Assessment will begin first in the first session with the client. For example, I would ask the question of, what brings you here today? I would start out with general questions such as their date of birth, immediate family, if they have siblings, in what order are they as far as in their siblings, their birth of origin, their paternal grandparents. It's about learning the history and family of the client. Who would you involve and how would you involve them? Well, who would be involved would be the client. If the client is 18 years and over and have provided a form of consent, it will be the client and the counselor. If it is a minor or adolescent, then the parents would also be involved with the client and the counselor. Now, there may be times where the minor might be a ward of the state, and then who would be involved would be the appointed guardian. And the reason why you would involve them and how you would include them is they may have pertaining answers to questions you may have about the client that will help in the assessment and the planning of treatment. Others who might be involved, if you counselor in training, will be your supervisor. And you can also use empirical literature reviews. You can also include those as part of your assessment. Thank you, and it has been a pleasure.